Hi, James. So this week is Men's Health Week. So today we're going to be chatting about issues that tend to affect men, and not just conditions, but also barriers to living a healthy life. So I'm here today with James Quinn, our clinic director and one of our awesome therapists. So let's just dive right in. So one of the main issues with men in healthcare is that a lot of men tend to put off treatment, and this tends to contribute to men dying on average 5 years earlier than women. I mean, they have a much lower life expectancy in the United States. Yeah. So men are much less likely to make primary care visits. They're a lot less likely to see their doctor on a regular basis for preventative care, but also to seek out help when there's something wrong. They're taught from a young age to just, tough it out and, you'll be fine. And so they put off seeking medical treatment. So what are some advantages in your experience of getting treatment early?
Oh my goodness. Early treatment, first of all, it's just way easier to treat. The longer you put something off, I mean, if you're talking, pain that's a month old, be it shoulder pain, back pain, knee pain, it's so much easier to treat early on. Once you reach what we call chronic pain state, if you have pain that's been present for 6 months, a year, 5 years, it ramps up the nervous system so much that it takes so long to calm it down. Not only that, I mean, really, when you've had pain that long, that's the body's new normal. So we have to retrain the body out of that constant pain state. But beyond that, it's just little things, really. I mean, that ankle pain, that heel pain, I mean, that could be an Achilles tendon rupture, 6 months down the line if it's not taken care of. That shoulder pain, every time you reach up overhead, you get this nagging pain. That could end up being a rotator cuff tear. If it starts out as just shoulder impingement or subacromial pain syndrome, but later on, it could be a rotator cuff tear if you let it go too long, right? Even low back pain, you get those kind of low back pain, muscle tightness. But
yeah, guilty.
Right, absolutely. That starts out really easy. And, if you start out with just a couple stretches, you can knock that out of the park in just a couple weeks of treatment. But if you let that go so long that it's, you got maybe the occasional nerve zing or your sciatic pain, that nerve damage can take a long time to undo. You let it go long enough, all of a sudden you have, muscle damage that may or may not be able to be undone. I've seen some crazy things, people coming in with years of nerve impingement that basically cause, muscle damage that we really just, you can get rid of all their pain, but sometimes those muscles can't ever return if you let it go too long. I mean, early treatment, hands down, all the way around. And this is purely from a musculoskeletal perspective, obviously from the entirety of the medical field. I mean, the sooner you can get in and get treatment, the better off you are. So, absolutely.
Yeah, and people tend to understand that with things like, cancer. That's something that people understand, early right. is better, but they don't always make the same associations with muscle problems.
Yeah, I mean, it is. You're like, well, I'm going to just kind of like your car, it starts making noise. You're like, I'm just going to wait and see if it goes away. You have some shoulder pain. You're like, I don't know. I'll give it another couple months. We'll see. But yeah, I mean, honestly, you're better off just going for it. I mean,
yeah. So that is, sorry, go ahead.
No, please.
So that is another problem that a lot of people, and especially men, they don't really want to make a big deal out of something if it's going to turn out that it will go away, and any kind of healthcare, it's not cheap. And especially with, the insurance system being what it is, it's not something that you want to go in for if it's going to just go away on its own. So what are some indicators that it's really time to go and see your physical therapist?
That's a tough question because it's not always an easy answer. How much pain do you have? Well, okay, obviously as the pain gets higher, past a certain point, you really want to seek help. But, it's not always about how much pain you're in. The other big indicator is it really changing, what you're doing on a daily basis? It's crazy to me. I'll see people, they're like, oh, I haven't worked out in a year because I've had pain every time I work out. I was like, you stopped doing something you really loved for a year and you're just coming in now? I think don't be, don't put things off because you're afraid, or maybe not afraid isn't the right answer, but you're like, I'm gonna wait it out. Also, there's easier ways to get in. It doesn't always have to be a long drawn out thing. Even here we offer free screens. So if somebody wanted to come in and just, hey, look at my shoulder, is this something that you think physical therapy is going to benefit? I mean, and that doesn't even cost any money, and it doesn't have to be a big deal. You come in, you talk to one of either myself or one of our other therapists, and just get kind of that short little assessment. At the end of the day, if we think it's something that can be treated, treat it.
And the free screens aren't too long either. It's not like a huge time commitment.
Oh no, yeah. Usually we try to keep those pretty short, about 15 minutes.
15.
Just run through a couple tests and kind of get the baseline. And if we think it's something we can help, then we go from there. But I think getting that first step is always the hardest part. Just do it. Even if it's not here, anywhere, and if it's not musculoskeletal, a lot of doctors' offices, don't be scared of that first appointment.
Yeah. And and that is one of the great things about TherapyWorks is they've been in Lawrence since 1996 or 1994. Sorry, right. Yeah, so they know the people. If it's not something you guys can help, where to send them.
Yeah.
The doctors, the surgeons, the chiropractors. These
Absolutely.
are all people
There's a good base of treatment. So at the end of the day, if there was enough of an issue that we saw here in a screen, and maybe it's something we felt like we couldn't treat in physical therapy, we refer you somewhere that you can get help if it's not here.
And does it ever happen during a free screen? Are there ever people that, maybe it's not something that's quite up to a physical therapy level yet, but it's something that you can give them a few things to try at home, or maybe they're not ready to start physical therapy, but they're kind of looking for a couple of suggestions to just improve day to day?
Yeah, I mean, it does. I mean, sometimes somebody comes in, they're like, hey, this is what's going on. If we feel like it's not something that really needs a full-on treatment, I mean, absolutely. Here, work on this stretch. If it's not gone in 2 weeks, come back in, and we'll get in a little more hands-on for sure. Yeah. Most of the time, by the time somebody comes in for a free screen, there's enough pain going on. So I wouldn't say that's a common thing that happens, but once or twice I've seen that happen. Like, hey, we don't need a full blown treatment here, but usually, if somebody's here, it's because they have something, enough going on.
Yeah. So once people are, especially men, once they do come in for physical therapy, what are some of the, most common problems that you treat?
Oh my goodness. Hands down, back pain, low back pain. Are you kidding me? And honestly, that's the most prevalent injury in the musculoskeletal field, and really almost in the entire medical field. I think it's something like 1 in 5 people. Yeah, it's like I was gonna say 1 in 4, 1 in 5, something like that. And that's not just physical therapy visits. That's literally doctor's visits. All across the board is like low back pain.
Wow. And why is that? Like, what's going on with backs?
That's a solid question. A lot of people theorize that it's just too much sitting. All of us are sitting too much on a day. I mean, that's our new normal. It used to be a lot more standing, but now we're just sitting all day at computers, and we're just really working for that. I mean, there's a lot of potential reasons, but that's definitely a big culprit. Back is definitely number one. And you get a lot of guys coming in. It's like, oh, you get the weekend warriors, right? Everybody's sitting all weekend, but then or sitting all week, come weekend, they're going out, they're trying to play 18 holes of golf or run a half marathon, and they're just, it's hard to make that transition when you're not doing all week.
Especially without stretching.
Oh, exactly, right. No doubt. I think that's definitely the most common. I think after that, of course we kind of break it down into ages, but probably shoulder pain is another big one. And again, you get people that are down here all day, and all of a sudden they get a weekend project that has them working over their head all day, or lifting things overhead, and you get a little tweak here and there that just doesn't go away.
Yeah, absolutely. And I mean, you mentioned weekend projects. So, both both at work and at home, a lot of the so-called the heavy lifting in our community often falls to men, whether it's, yard work or, having a job that's manual labor based. So what are some good ways to avoid injury while doing manual labor?
Oh, man. If it's something that you do a lot, if you're going to go out and you haven't been doing these things for a little bit, or you got a big weekend ahead of you, I think one thing to do, warm up in some way. If you're going to be up over here and you haven't stretched those shoulders and you haven't kind of warmed them up and you haven't done anything like that in a while, it's gonna be rough. So stretching is the easiest thing to do. I think when we're young, we don't even think about stretching. You just get up and you go and you're fine, right? But the older we get, it becomes so much more important. And it doesn't have to be aggressive, and it doesn't have to be a lot, and you don't even have to always be doing the exact perfect things, but get that light warm up in, get those stretches in. And sometimes it's, we were talking about low back pain in that last question. I mean, some of those things could be easily have been prevented if people were just using a little bit better, maybe lifting mechanics. We start to let you maybe start out the day, your back's feeling good and strong, but you lift 10 things or 20 things, you're bending over all day, those muscles get weak, and all of a sudden you're not using good form anymore, and that's when the injury happens. So
yeah, what are some good things to remember when lifting heavy loads?
Just keep that back strong, keep the back flat, keep weight close to your body. I mean, just the simple mechanics of it are pretty simple. And when you get tired, take a break, sit down. Hopefully you don't need to get it all done in 2 hours. You can rest in between, maybe get some light stretching in halfway between. That can help too, anything to keep those muscles limber and keep everything.
Yeah, absolutely. So I'd like to switch gears a little bit and talk about, I guess, sort of the elephant in the room. Men's Health Week tends to focus a lot on prostate problems because it is a problem that only affects men. So as a physical therapist, what do you recommend for men who are having problems with incontinence? Is that something that you can help? Is there a way to?
Definitely, it's often forgotten. Yeah, but absolutely. Physical therapy really is oftentimes a good first stop in a case like that. It's so funny because I think we think a lot of times, that's just a natural part of aging. If you have any issues in that regard, it's not necessarily. There can be some underlying conditions. Physical therapy can help a lot. A lot of the pelvic floor is made up. It's all muscle, so we can strengthen that. There's a lot of exercises that we can do in that regard. And if there were an underlying cause, hopefully we can get you referred to the right place if we're not seeing the responses that we would expect to see in treatment.
But tossing out the most common causes can help you eliminate that if that's not what it is, and then they can move on to the next place.
Yeah, I think
or be cured, or be doing well.
Yeah, right. Absolutely. No, that's always
there's a reason they start with you.
And it really does. I mean, it really does work. I've firsthand seen it work more times than not. And oftentimes there's even referrals post-surgical if you're dealing with anything prostate or bladder related. They're going to, oftentimes refer for physical therapy after those treatments as well, because they go in hand in hand. I mean, you can't really, if you've had those kind of treatments or surgical interventions, you really want to get that base strength back if there was anything damaged in the process. I think I read somewhere it's like 3.5 million men at any given time are struggling with incontinence and maybe not getting the treatment they need. And so
that's a lot of men.
Yeah, right. I mean, so, and that's at any given time. So yeah, I think it is an awkward thing. Nobody likes talking about it. You're right. It's definitely the elephant in the room. But honestly, we see it all the time in physical therapy. So it's not weird for us at all. And if you have the issue, I think it's definitely worth getting to the root cause, maybe seeking some treatment from physical therapy, giving that a shot. Because as maybe it is uncomfortable to do those kind of treatments, but it's more uncomfortable to struggle with the issues. So,
Sure.
Yeah.
Sure. And treatments, that can be a short-term thing or a medium-term thing. And then you have the skills and you have the strength, and you can carry that forward instead of it being a lifelong problem.
Yeah, absolutely.
Yeah. So, of course, no talk during Men's Health Week would be complete without mentioning heart disease, because it is the #1 cause of death in the United States, and it does tend to affect men more than women. So what are some tips that you have for avoiding heart disease?
The heart disease, it is, I'm a PT, so I'm completely biased, but this isn't really, this is a fair bias, I think. And that is #1. Exercise. So what are your risk factors, I think, for heart disease, aside from like diabetes, but you also have just inactivity, overweight, unhealthy diet, high levels of stress. All these add to issues with heart disease. So what helps all those things? There's a common denominator here, and that's exercise. Exercise lowers stress. Exercise can help you lose some weight. Exercise lowers your risk factor in and of itself, independently of those two things, for heart disease. It can help manage diabetes and those kind of issues. So yeah, without a doubt, I would say exercise. And so that's, maybe I'm a little biased, but I think even somebody not biased can look at the facts there and see that it would definitely be a pretty big help. Yeah.
Absolutely. So I guess just kind of in closing, I know that there will be a lot of people who are watching this who aren't men, and hopefully they also had some good takeaways. But I know that a lot of us have that, dad or uncle who has, that pain that he won't get checked out. He's like, I've always had a bum shoulder because I played baseball 40 years ago. Or, his back bothers him, but they insist that it's not a big deal and he's just fine. So what advice do you have to not just men, but to those of us, who have men in our lives that we love, what advice do you have for us to convince them to come in? What can we say to those people to try and get them to get the help that they need to get better?
I totally get you there. It's actually really funny that you asked that question, because I swear this week alone, I have had at least three female patients talking about how their husband has back pain, shoulder pain, but just won't come in. I'm like, send them in. We can at least check it out. They're like, I've been asking them to come in for 6 months. They won't come in. I'm like, oh my goodness, come on. How can we make that transition from, somebody complaining about pain all the time and encourage them to get in the door? I think #1, keep encouraging. I think that really does help. I've had kind of sit down talks with even friends of mine, it's time. You've been dealing with this for too long. You look at the things that you used to do and you can't do it. You're not enjoying it anymore. Let's go check it out. At the end of the day, nothing bad can come from getting things checked out. I think the other thing is, if it's somebody you love and that they got, a lot of times we don't go do things. It's, you're like, I don't have time carved out in the day. Make a point to try to carve that time out for them. Hey, if it's kids, if it's housework at the end of the day, hey, I'm going to block this time. I'll take care of everything tonight. You take an hour off work early, get in there, and I see almost every time when they finally make it in the door and I see these guys on my end, they're so grateful. They've been in this pain for so long. Guy hasn't been able to drive a golf club, off the tee for 6 months. He comes in here within 3 weeks. He's like, oh man, I was able to golf. It's not feeling perfect, but it's feeling way better. I can get out there and do it. I'm like, yeah, why? Don't wait 6 months. Let's don't let that happen again.
Absolutely.
Yeah. So just get in the door, whatever it takes. Give them that jump. Keep bringing it back into focus. And if it does take a little bit more, try to cut out that time and reserve it for them. And sure, everybody needs a little encouragement for self-care. We get so wrapped up in.
Yeah. And, in the free screens, that sounds like a really great way to start. I mean, it's low cost. It's not a lot of time. It's a good entry point for people that might be kind of resistant.
Yeah. Get in the door. Check that out. That is definitely just an easy thing to do. And it gets you comfortable too, coming in, you know what you're going to deal with. At the end of the day, if somebody came in and they're like, oh my goodness, this James guy's a jerk, I'm not going back, then that's fine. You know what I mean? But then, sometimes it is that. Maybe, you feel like you're not going to get along with somebody. Hey, who knows? There's always those little things. But that checks so many boxes. You just come in and see what's going on. So,
all right. So before we sign off, do you have any other things you'd like to add?
Oh my goodness. Stay moving, stay moving. We talk about how exercise, again, I'm definitely biased, but it doesn't have to be much, just put one foot in front of the other. If it's a walk around the block, a walk down the street. Heck, I have patients that when it's too hot, they're walking up and down the hallways just to get some extra steps in. Stay moving, stay healthy. It helps all the way around, not just physical, but mental health as well. So it's a great thing. Yeah.
All right. Well, thanks so much for talking with me today, James.
Yeah, thank you. I'm glad we got it worked out. I'm sure we'll chat again.
Absolutely. Thanks.
Bye. Bye.
Bye.